In this section, we'll be talking about the colonic diverticulosis. So if there are multiple diverticula which are present along the length of the colon, that is called as the colonic diverticulosis. And there are still few of the hypotheses which are trying to explain the process of colonic diverticulosis and their manifestation. So one says that if there's a vascular disease or there's a structural weakness, then this diverticulum can actually present to you with a diverticular hemorrhage. Or if there's a microperforation or bacterial translocation of focal ischemia, then the patient can present to you with acute diverticulosis and diverticulitis. So what happens is like multiple diverticula, they are present along the whole length of the colon, and they can be anywhere along the starting from descending colon, walnut transverse colon, and descending colon, but rectum is most of the time spared. And these colonic diverticulosis, that can be because of vascular disease, or that can be because of the structural weakness, and the patient can present to you with a diverticular hemorrhage. Or there is a microperforation or bacterial translocation of focal ischemia, and the patient can have the manifestation of acute diverticulitis.